properly respond.
Dr. Ranjeet Brar, do you feel as if you are in the middle of a surge right now?
Everyone has a feeling that it's the lull before the storm. We know that there's a latent phase. So there's a phase of perhaps it's variable and not accurately known, but they say between 2 and 14 days. But there's certainly a latent phase between point of infection and manifesting with symptoms. And there's a course through which the disease, COVID-19 disease itself runs, such that patients get worsening symptoms over a period of 1 or 2 weeks. And so the period between a large number of people being infected and a large number of people being serious unwell is likely to be this next 2 to 3 weeks. And yet already in London, which we feel is slightly ahead of the curve of the rest of the country, because it's an international city, it's a very large population, 1/5 to a quarter of our country's population actually live in London, the Greater London area. So this is a city which has been affected most. And already we had a hospital in northwest London over the course of last week, which had to declare an emergency. Its beds became full. Now we are trying to repurpose the resources that we have. So we're expanding intensivists, are recruiting anaesthetists. So people who would normally manage operative cases know how to manage respirators, know how to manage ventilators. So we're trying to increase our ICU capacity. We're dividing our A&E, our acute presentation areas. We're trying to divide that between respiratory areas where people with suspected and actual coronavirus will be treated, and separate those from the other general population who will need treatment. But all of that is difficult in a system which, to be frank, is straining anyway under normal pressures every winter, because it's been persistently starved or underfunded of resources. We know that about 8% of our gross national product is spent on healthcare, compared to most European areas or advanced economies spend in the region of 12% of their economy, and that's been a case of underinvestment for many years. So we are struggling with the resources we have. So obviously we're trying to do the best with what we have and mobilize extra capacity, and recognizing the urgent nature of the demand to mobilize that capacity is going to be key as to whether we are able to cope with the number of cases we see, or whether we too become overwhelmed.
Right. Roberto Costantini,